Tasmanian GPs have called for a radical rethink of the state's health funding to relieve the pressure on the state's largest hospitals. They say the government could do much more to fund preventative health and stop patients who end up in hospital from getting sick in the first place. Rural doctors say the state is losing talented young doctors because there are no guaranteed job pathways. Here's state political reporter Rihanna Whitson.
It's 5 o'clock on a Wednesday afternoon and the queue outside Hobart's only dedicated after-hours clinic that bulk bills is growing.
I've been here since probably 20 past 5 to beat the lineup because after 6 o'clock when it opens, it's just standing room only.
Next appointment with him was about a week from now, which is too late for my prescription, so I've come to the after hours.
Research shows that when after-hours medical care isn't an option, people are more likely to end up in a hospital emergency department. This Derwent Park clinic sees about 21,000 patients a year. The Australian Medical Association says more GP-based out-of-hospital care is needed.
I guess a classic thing would be, say, a child with asthma. We can treat that, but often you would like to keep an eye on them for a while. We don't have the room or the time.
Federal funding for after-hours GP home visit services has been reduced after concerns about quality of care. The AMA supported the move and says instead the state government should fund 24-hour short-stay units, staffed by GPs and supported by telephone triage.
We do need the will to change from all sectors, including, doctors, nurses, both federal and state government.
In remote parts of the state, like the West Coast, gaps in care mean patients present later and sicker.
There is one local doctor who's here regularly and for weeks and weeks and weeks, you can't get in to see him.
We have had people die.
Dr Dennis Passion is one of 3 permanent locums in Queenstown. They're on call 24/7 and also work in the town's small ED. Patients here have to wait months for visiting services like physiotherapy or travel.
We do have a higher mortality rate on the West Coast from cancer, from heart disease as a result. We have high levels of chronic disease with diabetes and kidney failure. All of these things mixed together mean basically we end up with people dying younger than they would in other states.
The Rural Doctors Association says the state is losing graduates from UTAS interstate.
There's basically just no job at the end of the line if I wanted to stay here.
Unlike in Queensland, the state government's program to train junior doctors doesn't have a guaranteed job pathway.
It's not all about the money, and you have to be able to apply those skills you're trained to use. And at the moment, that's the bit missing in Tasmania.
The immediate past president of the RACGP, Bastian Seidel, says a radical approach is needed.
Well, there's next to no investment in preventative care here in Tasmania. The government is really focusing on hospital care.
Although funding GP visits is a federal responsibility, it's increasingly becoming a state problem. And many practices are charging considerable out-of-pocket fees. Tasmania has the second lowest rate of bulk billed GP visits in the country.
The patient will call the ambulance that is perceived to be free, and the patient will be taken to the hospital. Quite frankly, that's going to cost the taxpayer even more.
It's not just about cost. Without change, doctors say Tasmanians will miss out. Rihanna Whitson, ABC News.
And Rihanna Whitson joins us now live. Rihanna, how has the Health Minister responded to these major concerns from the state's doctors?
The Health Minister's office didn't respond to direct questions about whether the government would support the suggestions to reduce hospital admissions put forward by 3 of the country's most respected medical bodies. He did say that GPs are a federal responsibility, although that doesn't take into account the fact that many doctors, particularly in rural areas, also work in the state's hospital system. This comes as news tonight that a Devonport medical centre will close its doors after losing all but one of its GPs interstate. That means the 3,000 patients on its books will soon be without a doctor.